Hi, my name is Michelle Memo. I'm a clinical registered dietitian here at Roswell in Buffalo, New York. Today I'm going to talk about what a PEG tube is. A PEG tube stands for a percutaneous endoscopic gastrostomy tube. It is a flexible tube that is placed through the abdominal wall into the stomach. A PEG tube also allows for nutrition, fluids, and medications to be delivered directly into the stomach. A PEG tube can be helpful or necessary if you are having trouble swallowing or are not taking in enough nutrients through your mouth, either due to surgery or side effects from your cancer treatment, such as poor appetite, mouth sores, or throat pain. A PEG tube can also be placed to decompress the stomach contents if there is a bowel obstruction. This is deferred as a venting PEG and is placed to prevent and manage nausea or even vomiting. So how are PEG tube feeds given? Special liquid nutrition products as well as fluids can be given through the PEG tube. Here at Roswell Park, a registered dietitian will complete a full nutrition assessment to determine the appropriate amount of liquid nutrition required to appropriately meet nutritional and hydration needs. Once a PEG tube is placed, it has to be used within 24 hours. A healthcare provider will give complete instructions and demonstrate using the PEG tube. So a PEG tube does not necessarily prevent or mean that you're going to not be eating by mouth, but a doctor may limit the amount that is able to be taken in through your mouth completely. So the caregiver and the patient should make sure they're thoroughly washing their hands with soap and water before preparing liquid nutrition or having any contact with the PEG system. The first thing I'm going to show is how to administer the flush with 2 ounces or 60 mLs of room temperature water before and after each feed. You can use bottled water, you can use tap water, you can use distilled water or any bottled water as mentioned. You cannot use well water. You want to make sure the water is at room temperature or lukewarm. You do not want to make sure it's hot or boiling. You can pour it into any container that you have available, and you want to make sure that you are using a 60 cc or 2 ounce syringe. If you have a smaller syringe provided by the home care, you're going to have to administer it twice. The smaller syringes may be 30 cc. If your PEG tube looks something like this, which would be the venting PEG, you are going to have to make sure that the part that's venting is capped. If it's uncapped, then you're going to see water coming out. So I cap it. I'm going to pull up some water for my flush before the feed, all the way to the top, which will be my 2 ounces. This is a full syringe of water. I attach it to the PEG and I push it down all the way in. So this way it's very secure. And then I slowly push it in. And as you can see, it's going in nicely, no water is coming out, and it's going into the container/stomach. You do not want to lie flat for at least 1 hour after you're feeding. You want to use room temperature liquids even for your formula. Always make sure that the formula has been shaken to make sure that the contents have all been mixed together. I have shaken my formula prior to. You can use the same syringe for administering your formula as you did for the flush. Refrigerate any unused liquid nutrition and bring to room temperature before putting through the PEG tube. So now I'm going to demonstrate administering the formula. I'm just using a different tube just to show how the formula goes in, but it's the same method. So you want to pull back the formula after you have poured it into your container. Attach the syringe to the tube feed, push it in to make sure it's secure, and push the syringe down. As you can see, my formula is going in. There's no clogs or kinks in the tube, and it's all administered. After I have administered the formula, you want to give another full syringe of water. If you have any questions about the care or functioning of your PEG tube, talk to your medical team. If you have any questions or concerns about your nutrition or hydration, talk to your registered dietitians at Roswell Park. They'll make suggestions for changing your regimen. Thank you and have a good day.